My first grandchild was born. My daughter-in-law said, well, what do you want to be called? I have to tell you, I don't want them to call me Grandpa. I said, I want them to call me Lucky because I'm lucky to even get to meet him. My story starts when I was 15 years old and became a juvenile type 1 diabetic. I guess in my youthful stupidity, I took into account that I'd probably be sick and maybe have a difficult life, but I didn't really care. I just strived to live my life as fully as I could, despite the fact I was being treated and had an illness. And for the most part, it was uneventful until I turned 40, and then I started to have vision problems. I had a heart problem. Being out of breath at 47 years of age, just walking up the steps is not normal. I underwent a quintuple bypass surgery. Diabetes is such a horrible disease because it affects everything. My kidneys were stressed out, and I had about a year until I was going to be on dialysis. I was a good candidate for a kidney pancreas transplant, which I didn't even know existed. I thought I was doomed to be diabetic for the rest of my life. I came to Our Lady of Lourdes and consulted with Dr. Yusuf. He agreed that I was a good candidate. Then it was a matter of being put on a list and waiting for my kidneys to fail to the point where an operation could be done. In that year, I probably visited every emergency room in South Jersey because I started not to be able to metabolize my insulin, so I was just passing out. Then the day came when my kidneys finally failed, and I went on dialysis, and within a month, I was called for my transplant. When I speak to other people who are about to undergo this or considering undergoing this, I'm candid with them. It's hard because, you know, you've had a lot of things go on, new organs all attached, but it's not painful, it's just a process. And if you can look at it that way, it's a beautiful process because you know you're getting better every day. I wrote a letter to the relatives of my donor expressing my gratitude and how it's changed my life. I did actually get to hear from the family of my donor. You have to think that this is the human condition, that people are going through tragic things and beautiful things at the same time. So we sort of share an event from a different perspective. Every year on what I call my rebirth day, on the 21st of January, I personally bring a decorated cake to the dialysis department, to the transplant administrator's department, and to the nursing floor with a personal note. I have to say it was the greatest event of my life in terms of turnaround of my health. If you look at my tests, my blood work, you'd never think I was ever sick a day in my life. Everything is normal. And that's it. What more could you ask for than that? The goodness in this hospital, it sets itself apart from other places. I see the difference here. It really is a caring and loving institution. And I think that if you can attach a gift to the hospital with some recognition for somebody that's made a difference in your life, how you've changed that person's life, as well as made a contribution to help the organization that helped you.